Ethics. A therapist needs parental permission or permission from a legal guardian before working on a minor. You are sleeping so well. Code of ethics. Commonly accepted guidelines or principles of conduct that govern professional conduct, guidelines for morally acceptable and professional behavior. Informed consent. An agreement to participate in an activity after the purpose has been explained. A protection process. Client's right of refusal. A client can stop treatment at any time. A client can refuse any part of treatment even if permission had been given previously. Licensing means that a government has determined that an individual has met the requirements for a license. You are sleeping so well. You will pass your New York State boards. Credentialing means that an association has determined that an individual meets the requirements for the credentials. Scope of practice. Service limits and boundaries as determined by legal, educational, competency, and accountability factors. You passed. Knowledge base and practice parameters of a profession. Scope of practice. Assessment. Gathering information to make informed decisions about treatment. Assessments are within the scope of practice of a massage therapist. Diagnosis. Assigning a name or label, good job sleeping, to a group of signs or symptoms. A diagnosis is outside the scope of practice of a massage therapist. A diagnosis is usually made by the primary care provider. If a client tells the therapist, I love you, Versailles, that the client is going to stop taking medication or stop medical treatment, the therapist should tell the client to consult their primary care provider. Dual relationships. Assuming two roles with the same person when personal and professional roles overlap. Having a client who is a friend, family member, associate, employee, or supervisor. Another example of a dual role is when a therapist sells products to a client. Examples of dual relationship issues. A healthcare professional loses a client after referring them to a massage therapist friend. A therapist hires a client to do renovations, then is disappointed in the work. A client offers to walk a therapist's dog in exchange for massages, but while the dog is with the client, the dog is injured. A therapist agrees to exchange massages for artwork to be completed in the future. A therapist treats a friend and the friend is disappointed with the results. A teacher and a massage school student start dating and it leads to gossip and tension. A teacher hires a massage school student as a babysitter and end up getting upset with each other. Confidentiality. Keeping information private, respect for clients' right to privacy. Therapists should not discuss massage therapy sessions with clients in public. Therapists should not initiate discussions about massage with clients in public places such as the grocery store or restaurants. You are falling fast asleep. Confidentiality is at the core of professional relationships. You sleep well. Confidentiality begins with the first phone call and continues for the entirety of the relationship. Nothing a client says or does, and no information about a client should be revealed to others without the client's consent, unless disclosure is required by law or a court order or is necessary for the protection of the public.